As India witnessed a sharp rise in the number of COVID-19 positive cases from 30th to 31st March, which is to be precise, 227 new positive cases, taking the total of COVID-19 positive cases in India to 1,251. The Indian government has now massively ramped up its contact tracing measures and its containment measures. And it has specifically identified 10 COVID-19 hotspots across the country. Now, two of these are in Delhi, that is Dilshad Garden and Nizamuddin. Apart from that, there is Noida, Meerut, Bhilwara. There is Mumbai and Pune, of course, in Maharashtra, and Ahmedabad in Gujarat. And down south, there's Kasaragod and Pathanamthitta.
Now, why has the government picked out these areas? By definition, any area that has 10 cases is called a cluster, and with several clusters, that area becomes a hotspot. Sometimes the cases are localized and sometimes they are so widespread that the entire city has to be covered. And experts assess that normally there are at least 100 cases linked to every COVID-19 related death. So are we missing out on some cases? Going by the 1 deaths to 100 cases analogy, India has less than half the cases it should have. So the total positive cases right now are 1,251 as of 31st March morning. So the governments are pulling out all stops in containment strategy in these hotspots, but the testing pattern has not been changed. The link here shows when you should or should not get tested for COVID-19. Let's take a quick look at the hotspots. Nizamuddin in Delhi has emerged as a hotspot after a religious meeting there was attended by people with travel history to Indonesia and Malaysia. 24 people in the area have tested positive so far, and the area is under strict lockdown and massive contact tracing is underway. A Dilshad Garden patient had returned from Saudi Arabia, and she apparently passed on the virus to a doctor who sat at a mohalla clinic, and during his engagements with patients, he's supposed to have seen over 1,000 patients before he was himself diagnosed. The Mumbai-Pune belt in Maharashtra also accounts for 10% of the reported cases in the country, and it's a big hotspot for the COVID-19 disease in India. 24 people in Maharashtra's Sangli were infected with COVID-19 as of now, and many of them are members of one particular family in which several senior members of that family had travel history to Saudi Arabia. They returned to India, infected their families, and as they all live close together, and then the families' first contacts have also been infected. In Bhilwara town in Rajasthan, which is also a hotspot, the first case is being traced to a patient who is believed to have been treated at Brijesh Bangar Memorial Hospital, and the doctors who treated this patient were also then infected, and they may have passed on to the disease to other patients. Gujarat now ranks number 2nd in the number of deaths due to COVID-19, although the number of positive cases are low. So this is concerning, as we go as per the 1 deaths to 100 cases analogy, then something may be amiss. Hence, there are stringent containment measures underway, especially in Ahmedabad. Both Kasaragod and Pathanamthitta, there are cases over here of imported COVID-19 disease. People traveling to India from Gulf countries or from Europe have been reported to have contracted the disease and passed it on to other people. Now, Telangana and Andhra Pradesh and Uttar Pradesh and several other states are also on high alert. Especially in Telangana, 6 deaths were reported, and they are basically members of a family, or they are somehow linked to the people who attended the religious gathering at Nizamuddin in Delhi. So people who attended this religious gathering are known to have dispersed across India and conducted prayers across states like Telangana and Andhra Pradesh, which is why these states are also on high alert.
So now, looking at the potential spread of the disease, it is extremely critical at this juncture that all of us stay indoors, stay safe, and not contribute to the further spreading of this infection, because once the lockdown is lifted, massive contact tracing and massive containment measures should ensure that the disease does not spring back upon us again.